Welcome back. It is a procedure that can be life-saving. Imagine getting a cancerous tumor removed without, however, having to go under the knife.
That's right, and that's what our next guest says that he and his staff have the ability to do. Dr. Timothy Jamieson is a board-certified radiation oncologist with the Southeast Georgia Health System. Thank you so much for joining us today.
Thanks for having me. It's a pleasure to be here.
So let's talk about, you're here to talk about CyberKnife, but even though it's called CyberKnife, you don't necessarily have to go under the knife.
Absolutely. It's a play on words. It's actually high-dose radiation. We shoot from hundreds, 200 different beams focused on the tumor with just typically 1 to 5 treatments, and we're done in a week. So it's radiosurgery, and the radiosurgery is not surgery cutting. Radiosurgery is just high-dose radiation done in a short amount of time. Most people think of radiation, conventional radiation, as 5 days a week for weeks and weeks and weeks. CyberKnife radiosurgery, everything's compacted into 1 week, because we can safely deliver a very high dose per day, and so you get it done faster. And not only is that more convenient for a patient,
Absolutely.
it also does a better job of killing the tumor, because the tumor sees a huge dose in a smaller amount of time. And so, for instance, we'll control 90% of lung cancers that we hit with CyberKnife. With conventional radiation, it's much lower, in the order of 15%. We treat a lot of prostate cancer. That's our most common thing we treat. We treat it in 5 days. It's 5 half-hour outpatient sessions. They just lie on a table. And there's a lot of planning that goes into the delivery, but they're essentially patients lying on a table, watching TV in the ceiling, and we're shooting at it from about 200 different beams at the prostate. Then they get up and they go to work.
It has to be a relief for a lot of the patients not having to go through this prolonged experience that can be very uncomfortable. And you say, to your point a second ago, that the patients go through a few steps before they actually go through the CyberKnife therapy, and you say like medical imaging scans, and so what goes into the workup?
So depending on what body type we're treating, for instance, a prostate patient, prior to all this, will put 4 tiny gold markers in their prostate. The urologist will do that. And then they come to us, we lie them on a little bean bag, suck the air out of it, conforms to them. Then we do a CT scan of their pelvis and then an MRI of the pelvis. They go home. Those images go in our computer. We outline the prostate, the bladder, the rectum, all the normal structures, generate all the beams, typically a couple hundred, keep tweaking it, optimizing it until we get the dosing that we like. And the dosing we like is a nice high dose on the prostate, rapid dose fall off, minimal bladder rectal doses. And then we do a bunch of QA and the patient's ready. He comes back. He's typically in our department about an hour a day. The treatment itself takes about a half an hour. They're lying on the table. The robot's moving around, shooting the radiation at him. And the CyberKnife is essentially a linear accelerator on a robot arm, so we can shoot from hundreds of different angles. And we're constantly tracking where the prostate is. So the prostate moves, and we have an elaborate system to track the motion, and the robot moves with it. For a lung cancer patient, which we treat a lot of, a pulmonologist put 4 little gold markers near the tumor. We scan them, same procedure, do all the planning, and then when they get treated, they're lying down, and they have LED markers on their chest. And as they're breathing, their chest moves up and down. We're mapping out their chest motion. We have x-rays from the ceiling that are figuring out where the markers are, and the computer builds a model as to where the markers are in relation to where the chest is. And then when we're firing the beam is actually moving with breathing and hitting the tumor all throughout the breathing pattern.
That is incredible.
So that ensures that we hit it and we miss as much normal lung as possible.
Now, you mentioned prostate and lung. Are there any other cancers that this process
CyberKnife can treat anything in the body. We treat a lot of prostate, a lot of lung, a lot of brain tumors, spine tumors, liver tumors, any type of recurrent disease as well. So someone's previously had radiation and has a recurrence, and you can't really deliver further conventional radiation, we can CyberKnife those to a very high dose and spare the normal structures.
And when I hear you talking about, radiation and targeting the tumor and having the robot around you, I think, what is the experience like for the patient? Is it comfortable, and what are some of the benefits, obviously, beyond no surgery, not going to have to have under the knife?
So it's very comfortable for patients. It's a big room. There's nothing confining. There's no claustrophobia. And they know the robot's spinning around them and shooting, but they're not feeling any X-ray. They're just essentially watching TV and relaxing.
There's no pain.
There's no pain. Now, there are, of course, any type of radiation is going to have side effects, but when you're actually treating them, they're not feeling anything. They can go off to work, go off, play golf.
Dr. James, before we run out of time, I do want to ask you hear so much about proton radiation therapy.
Yes.
What is the difference between CyberKnife versus that therapy that you hear so much about?
Sure. So, protons is a charged particle. They still treat patients 5 days a week for several weeks, 7, 8 weeks. And they have a huge marketing scheme. the data for CyberKnife is every bit as good, if not better, than with protons. In my opinion, there's a lot of ways to cure prostate cancer, and CyberKnife is the sweet spot between very high cure rate, minimal side effects. It's the lowest cost of any radiation. And patients are done in 5 days. It's complete ease of treatment.
No anesthesia, no pain.
Right,
Yeah.
and folks who see me before they have protons almost invariably will choose CyberKnife. So it's just awareness. And I would urge people to seek second opinions and come talk to us.
Remember CyberKnife.
CyberKnife.
Well, thank you so much, Dr. Jamieson. And of course, we'd like to thank the Southeast Georgia Health System for sponsoring this segment. So for more information about their services, the locations, and more, you can visit www.sghs.org or give them a call at 912-466-5149.
And for more information about CyberKnife or to schedule an appointment to talk to Dr. Jamieson, you can call 1-800-537-5142, and the extension's there on your screen, which is 5149.